Good evening, good evening. Welcome, family. Welcome, everybody. Welcome here to the People's TV. This program is held every Monday at 8 p.m. from 8 to 9 p.m. And we touch on different subjects of importance to our communities. And what we do here, we start conversations, right? We start dealing with topics, and sometimes we repeat the topics from Monday to Monday. But what's important is that this is an introductory or a start of discussion, right? This program was created and is produced by the People-Pueblo Party that believes in common sense politics for the people, the planet, and the animals. And so the People-Pueblo Party holds workshops and monthly meetings the first Wednesday of every month, where we can get into deeper discussions and we can really talk about and dig in deep to the topics that are brought on this show. Being a live show on Facebook and YouTube is not the most conducive for in-depth discussion, but it is very good to initiate conversations and to highlight different perspectives rather than just following the mainstream corporate media and being lost and even possibly losing your life because people are watching Fox or CNN or MSNBC, who really cater and are controlled by corporations and billionaires. They really don't look out for our interests. And so we need outlets like this that are going to look out for our interests. And our program is sponsored by the People's Health Project Incorporated. They're the ones who make our software and hardware available for us to be able to put on this show. So tonight's topic is, we want to stop COVID, and we want to have a concrete discussion around how we stop COVID. Now, I also have a couple of videos that I want to share with you, and I'm going to share the links in the chat so that, on your own time, you can go back and look at these things. And what I want to do at this point is I just want to raise a couple of things, right? Because, I'm a teacher, I teach high school. And sometimes, some of my students are telling me that, nobody saw this thing coming. There's really nothing we can do, and it's kind of like this narrative of, depending on the government, depending on somebody outside ourselves to do the right thing. And so what I've been doing lately is tailoring my lessons to concrete things that young people, adults, all of us can do, really, to stop COVID and to save lives. There are demands we have to make at the government because the government has the regulatory power and the government also has the resources to stop the disease. But, if the government is not going to save us, then we need to save ourselves. We need to save ourselves, our family, our communities from the death and destruction that's going on. There are over 1,000 people every single day in the United States dying from COVID. The United States now has over 1 million cases, and daily the number of cases is rising to the tune of 200,000 cases every day. And if we don't push and implement public health measures to save lives, many, many, many more people are going to die. This over reliance on a vaccine, is a way for the government and the corporations to not implement the necessary public health measures. So my name is Brother Mark. My co-host is Brother William Hargraves III. And he'll be coming on in a little while. I think he's trying to stream in now. Let me see if I can get him on so he can introduce himself.
I'm actually in the car, so it's not a good visual. But
That's all
anyway,
right,
good.
brother. We can hear you fine. Do your intro. Let us know how you're doing. And you already know the topic, and we have a special guest waiting. So say what's up.
Okay. All right, what's up, everybody? I wish everybody a safe week, especially especially given the times we are in and with the expanding of the uptick with the coronavirus. I also want to take a time to realize that this is a week where we deal with a lot of family because it's about family gathering. I mean, it's Thanksgiving. I personally don't celebrate any holidays. I don't believe in them unless they're holidays that make sense, like Juneteenth or Black Solidarity Day. But I do perform a vital service for the community because sometimes people lose their way or they may be down and out, and just so that they can have a resurgence or a belief in themselves and mankind, humanity. And so that's being said, I just want people to realize that, think about the times that we're in. Think about that it actually started with indigenous men and the atrocity that was brought upon them about from the same people that oppressed us. So don't get caught up in these holidays. Same atrocity that we found when we was dragged from our native land, the Native Americans found when um, our oppressors came and sabotaged their life and their land as well. So keep that in perspective. You can celebrate what you want to celebrate, but really understand what you're celebrating. It's very important to not get brainwashed by all these smoke screens that they put in front of us under the auspices of being American. So, that's what I have to say. I always try to bring it back to the essence as it relates to common everyday folks, such as people of color, such as the Native Americans and things of that nature. So that's my intro.
Thank you
I
for
want to be
that intro.
consistent.
That was very good. Now, I'm sharing on the screen. You know what Robert says, right, Bill? He says
Can you hear me?
you sound better in the car than you do when you're upstairs. So I thought that was
Okay.
pretty good. I
Maybe
mean,
maybe
whatever
maybe
you're
I gotta
doing
stay in
down
the
here,
car
the
then.
sound quality is much better.
Now I can barely hear you now. I don't know what just happened.
All right.
Say something more.
Well, I was saying how good you sound in the car, and Robert was saying that too.
Hey, Mark, I was hearing you good. My volume's all the way up. Where happened to the volume? I can't hear it.
I don't know. But Bill, what we're gonna do is we're gonna bring on our guest now, and
I can't
start
even
our
hear you now.
conversation.
I can barely hear you now.
Okay. So let me, yeah. Well, I am. Let me know when your sound comes back on. We're gonna bring in our guest. Okay. So we have a very special guest tonight. Is Sister Jessica? She's from the People-Pueblo Party. She also works with People's Health Project Incorporated, and she is a physician assistant. And during when COVID first broke out in New York City, she was the head of our program to deliver food to folks who couldn't go out to get food. And she was also instrumental in providing food and sustenance to emergency room workers across the city in different hospitals. And also, she led our efforts when the hospitals were sending people home, right? Uh, she led our efforts to make sure that people got better and didn't pass away. And she's just an amazing individual, and she just happened to save my life as well on more than one occasion. So I'm very happy to have her on today. And Sister Jessica, you're here. Thank you. Uh, your mic is open.
Okay. Hello. Hi. Good evening, everyone. How are you? So, like Mark was saying, I'm Jessica. I am a physician assistant by profession. I've worked in the emergency room, urgent care, and currently dermatology. Well, not currently, but before COVID hit, I was in dermatology. Um, right now, I am taking a hiatus due to the pandemic, but I've been involved with the research and keeping up to date. I have several friends who are currently working in the emergency rooms and are actively taking care of COVID-19 patients. I have friends in Atlanta, I have friends in Hawaii, and I have friends right here in New York City, where we're based out of. So today we're talking about COVID. Now, Mark, did you want to show the videos before I start going into some of the topics?
Yeah, that'll be good, and that'll be kind of like an entry into the discussion. Earlier during the welcome, I was talking about how some of my students feel like, oh, there's nothing we can do, that nobody saw this coming. And actually, it was George W. Bush, the warmonger, who actually set up the first task force to deal with pandemics. And then after him, Obama came in and had a, upgraded the task force and really built it up. And and the World Health Organization for years now has been warning about pandemics. And so the idea that we didn't know this was coming is absolutely not true. Uh, I mean, the specifics of COVID, we didn't know that, but we knew that a pandemic was coming. And if you look throughout history, pandemics, I mean, there was the HIV pandemic recently, the Hong Kong flu when Bill and I were little kids, when we were younger. So pandemics have been with human history. And so the to excuse the negligence and the corruption of the government by saying we didn't know this thing was going to happen is incorrect. And actually, in East Asia, they've done the right things to control this pandemic. And I just wanted to show a brief piece of a video that I got from the Wall Street Journal, and I put it on my Facebook page. And so I wanted to share it with folks. And folks can go to the Facebook page if they want to read the whole article or they want to see the full video. And I'm going to do a screen share, and it's going to be from my Chrome tab. It's going to go to Facebook. Jessica, can you see my Facebook page here?
No.
Okay, you can't see the Facebook page? Oh, because you're a guest? Is that what it
I
is?
guess so.
Okay. So how about now? Can you see anything now?
No.
Okay. So let me put it in the chat. Let me see. Can folks see the video I am sharing? Okay. So I'm going to ask that. And really on this video, I don't really want to play the video as much as I want to show a picture from the video, right? And let me see, where's the part here? Here it is. All right, so I want to share this. And you can't see this, right, Jessica? Can you see it at all?
Mm-mm.
What I'm trying to share? Let me see if I'm getting responses on the chat. You say no, they can't see the video. Okay, so what it is, the part of the video that I wanted to show is a graph, and the graph shows the number of COVID cases skyrocketing in the United States, right? And actually, here it is. So now we're talking. See, all right. So the technology gods are on our side today. Okay, so let's see if we can put this in a way that makes sense. Okay, well, I like it like this better. Okay, so what this blue line is here, can you see this blue line, Jessica? This is the United States and COVID accelerating, right? And these squiggly lines under it are France, Italy, Spain, and then there's a straight line on the bottom is zero, right? And the countries that are on that zero line are China, Hong Kong, South Korea, Vietnam, Singapore, right? And so in those East Asian countries where they had lockdowns, but during the lockdown, they right away hired more public health workers. They provided people with a source of income. They did contact tracing and testing right away, and they had masks available for the general public. So they had to lock down like we did, right? And their economies took a serious hit, and people, suffered emotionally because of that. But you know what? They're opening restaurants, they're opening schools, they're opening sporting events, and their economies are starting to pick up because the rest of us are still locking down, right? And so I'm going to put the link in the chat, but I want people to go and see that. It's from the Wall Street Journal, which we know is not a friend of working people, but the Wall Street Journal is coming at it from a point of what's best for big business. And according to the Wall Street Journal, what's best for big business is to get COVID under control. I mean, in Asia, they even use apps that tell you where COVID is exploding, and so you can stay away from those places. And so they're using the technology that supposedly we invented or we created or we have under control to stop the spread of COVID. So, I wanted to share that because, this idea that there's nothing we can do to stop this thing is completely false. That's put out there so that the government here and the corporations who run the government can be exonerated for their corruption and for their ineptitude. Okay, so I just wanted to share that. I don't know if you have thoughts on that, or did you want to share something else?
Right. No, absolutely. We have been completely lacking in governmental support and direction in terms of how to safely open up and giving folks direction, right? Guiding them into the safety protocols that have been proven to work. It's very simple. Wear a mask everywhere you go. Try to avoid indoor spaces as much as possible. This whole idea of 6 feet, this magic number, just try not to get close to people. I don't think that at 6 feet magically you will be, immune to the virus. What's most important is the mask. We must wear masks. We must do contact tracing. We're not doing contact tracing in this country, at least to the level that the other countries who have been successful in this are doing. We're not providing. If people do get sick, people still going into work. They need money because if they stay out, is that employer going to give them 2 weeks pay to recover? They're not. There has been no national law to give employees 2 weeks pay. That does not cut into your normal and regular sick time. So yeah, absolutely. This country has been lacking and it is just a shame. We are supposedly the richest country, the most powerful country in the world, and yet we have the highest number of COVID cases.
Yeah, I mean, also, I was reading an article today that said that about 8 million more people have been pushed into poverty because of COVID in this country. 8 million more people. It's insane.
Right, and those numbers are disproportionately affecting people of color and women. Some of the things that have been affecting, besides getting COVID, but some of the things that have been affecting people of color and women are the job that they're not getting, right? Either they've been laid off and they haven't been able to get jobs, homelessness because of the loss of income. People are also finding that they cannot get food, again, related to loss of income. And all of these things have been found to be disproportionately affected people of color and women. There also have been finding that there's an increase in mental health issues during this time of COVID, and there's no support for that.
Let me ask Bill. Can you hear me, Bill? I don't know if Bill can hear us. So let me unmute him. Hey, Bill, can you hear us?
Yeah, I can hear you.
Okay. Did you have any questions or anything you wanted to raise in terms of COVID and what's going on? I mean, right now you're in Harlem. I mean, is there anything you wanted to ask or raise?
Well, you breaking up a little bit. Hold up. You breaking up a little bit, and I got competition. So hold on. Give me a second.
God bless you,
Um,
baby. Yeah, no,
yeah.
just if you
So
had any questions or comments you want to make about COVID in Harlem or
well,
anything else
I
you were thinking about.
mean, I mean, I'm piggybacking on what Jessica said, and that's pretty much you just gotta use your own discretion and your own common sense because you get mixed signals. I mean, is a mask good enough? I mean, what kind of mask is good enough? Is 6 feet good enough? I mean, you really don't know. I mean, is it something that was you got to ask what role the government played in it, not just Justice Trump. Is it something because the government has always I don't want to be a conspiracy theorist, but the government has always found ways to generate money. Remember, we're still looking for the weapons of mass destruction, right? When they knew that there was no weapon. So you got to the government has always played a role into giving millions and billions of dollars to certain entities, certain corporations by creating hysteria, whether it was real or it became real because of them planting that seed and doing their part to act on it. So because of that, the life you may save is your own, maybe your own and your family. So you just, again, I go to what I said earlier. People have to educate themselves, like you said too, Mark. We're talking about the Hong Kong flu and other things, pandemic that we had. Don't just listen to Mark or listen to Jessica or myself or whoever that you may respect their opinion. Do the research, connect the dots. There's a story, and the story doesn't change. It doesn't vary much. It's a consistent story. But what does kind of baffle me living in Harlem is that people are starting to get the sense that they're buying into wearing masks. But how many times I was walking down 8th Avenue and I was counting the masks, how many masks that obviously people put on their face, but I walked over on the sidewalk. So you thought it was important that they had masks, but in the same breath, you would discard them on the sidewalk. And that just kind of that's something I scratch my head with things of that nature. So I mean, I really don't have much to say other than um, just educate yourself. To be educated, to arm yourself is through education, whether it's reading or going back and revisiting history and see the similarities. Because you'll start see the more you familiarize and weaponize yourself with education and the history, the American history, ugly or otherwise, the more you'll be more informed onto certain things that the average person won't think about, things that questions that you ask that other people don't ask because these you should challenge. You should challenge your thought process. You should challenge the so-called experts or the people's in charge. Because why is certain things a certain way? Why do we have more um, diseases or more sicknesses in our neighborhood? I'll tell you an example. For instance, my cousin said you gotta care for AIDS, which now people can really live with AIDS. It's a cure for AIDS. And she gave me something to think about. She said, you know why you got to cure for AIDS and you don't have a cure for cancer? Because AIDS was predominantly in our neighborhood. And they realized that they wasn't going to make billions and billions of dollars because we just didn't have the money. So they decided we might as well give them the cure. And I never thought about that. And whether that's true or not. But with cancer, cancer is all sectors and all ethnic, across all ethnic lines. And because you can make money off of that, unlike AIDS, you don't really have a cure for cancer. And that's just what I'm saying when you challenge yourself to certain possibilities, whether you believe it, whether it's a conspiracy theory or not, but just challenge yourself, thereby challenging others. So that's what I have to say pertaining to that.
Yeah. You have any comments, Jessica, or any thoughts?
No, absolutely. I mean, the history of medication and treatment of viruses and bacteria in this country has been highly linked to making money. The old saying that it's, more profitable to keep us sick than it is to cure us of these illnesses and ailments. I mean, that still holds true. You know, AIDS, HIV has been around for so long and they understand how it works, yet there isn't a treatment that is widely available, right? Right now, they are able to keep it under control, but if there's a treatment that is widely available and anyone can get it, is not yet to be established. Just like cancer, does reach all people, colors, income levels. More so, I would say, is disproportionate to people of color. Um, but it is a lot cheaper, and we understand how cancer works. It's just cells that abnormally replicate. But why is there no treatment, right? There's a treatment that can at times make you sick, make you sicker with chemotherapy. Um, so, it begs the question, do you trust the government and the community, the science community? Now, there's the science community who, really do want to come up with treatments and vaccines that work um, and cures. And then there are the pharmaceuticals that have their hands in the science community, who, if the science community does not do what they want, they won't get their research project funded. They won't get their medication funded to help,
Mhm.
these communities. So we have to think about these things. So Yeah, I agree with Bill and a lot of that, and that we as, individuals need to also do our own research and really look into, where these medications are coming from. What is the driving force behind getting a cure or not getting a cure? Why is it that, some things have a cure and some things don't?
Yeah.
Um, and some of it, not to say that, this is a big conspiracy theory to keep us sick. We've had great strides in treatments and vaccines and things like that. But it's just, it makes you think twice about it. Yeah.
Right. I mean, part of I think that because we live in a capitalist society, and I don't know if the guests can see it, but on the screen, Jose Alfaro put up a question. Some folks have linked the high number of COVID cases in community of color to slavery. Can you discuss how this is possible when slavery ended in 1865? And I think is absolutely has to do what you and Bill were talking about. This legacy of slavery, this legacy of exploitation under capitalism. And so when our folks go to a medical facility, they're looked down upon. The illnesses are laughed at by different, staff who don't care about them. And then the facilities themselves don't have all of the equipment or necessary medications to help our people. And then a lot of our people are what they call quote unquote essential workers, and they have these low wage jobs where you're seeing a lot of people constantly coming through, whether it's in restaurants, whether it's in grocery stores, whether it's in laundromats. And so all of that is a legacy of slavery and capitalist exploitation. Capitalism, and I think the problem with the healthcare system in this country is that it's a for-profit. The more you go in, the more they bill you. You know, where what we need is a type of Medicare for all or public health system where profit isn't the driving force, but actually taking care of people is the driving force. And there's been studies out, multiple studies out. Over 70% of the American population supports public health care, Medicare for all type thing. So, and even Republicans, by a majority, want a healthcare system that doesn't focus on profits but focuses on health. Right now, I know there's a lot of talk about vaccines. And the other day I heard a news report that so and so country was trying to hack the United States to get information about the vaccine. And I'm thinking, wait a minute. If the United States comes up with a vaccine, aren't we supposed to share it with the rest of the world? I mean, why would any countries want to hack our vaccine information if we're supposed to share it so that everybody could be safe? I mean, what do you think?
Yeah. Well, first, let me try to chime in on Jose's question in terms of the link of COVID in our communities of color and slavery. And I don't know if you've read this report, but it's by the CDC because you said everything they said. And I think you did not read this report. So the report is Health Equity Considerations and Racial and Ethnic Minority Groups. So what they're saying based on their research is that the factors that contribute to the increased risk of COVID is number one, discrimination. So we have racism included in that, healthcare access and utilization. So people from communities of color or poor and working class communities are more likely to be uninsured, right, than whites. And healthcare access can also be limited. If you think about the immigrant community, a lot of them can be undocumented and therefore you get no insurance, right? So, how can they get the access to healthcare? And like you said, they are also working in essential healthcare workers, right? They're frontline in the grocery stores, they're frontline, in the factories, right?
Mhm.
Construction. And these are people who are not insured. You have occupation. So again, people from racial and ethnic minority groups are disproportionately represented in essential work settings. Again, healthcare facilities, farms, factories, grocery stores, public transportation. Then we have the educational income and wealth gaps. We know from long studies that have been researched over and over again throughout the years, there are inequities in access to high quality education for our communities of color and people who are from low income and working class communities. You have barriers to access to education, to colleges, etc. Then we have housing. So some people from racial and ethnic minority groups live in crowded communities that make it more challenging to follow prevention strategies. So take a state like New York or a city like New York City. I know so many people who live with more than one person in the apartment, and these are not their spouses. These are friends. These are families that live with other families, people who are renting rooms in a multi-bedroom apartment. They're living on top of each other because they cannot afford the rent. So that is another reason why we have this increase or disproportionate increase of COVID in communities of color. And this is all, in my eyes, linked to slavery. Now, in terms of, if you have anything to say about that, feel free to chime in, but I can continue on to the vaccinations and the vaccines.
Yeah, I think there's so much hype around these vaccines that we really do need some sorting out of this thing. So whatever information you could bring is going to be really appreciated.
All right, so vaccines. There are several types of vaccines. Let's just go into first what vaccines are. There could be 3 to 4 different types of vaccines. You have a live vaccine, which is that an actual virus that is a little bit weakened. Okay, it is weakened, that is injected into your body, and the idea is that when that virus is injected into your body creates antibodies towards that and can help fight it if you get the full blown out virus. There are also pieces of viruses that can be injected. There are now genetically engineered viruses that can be injected, and also different parts of viruses that can be injected to create a vaccine. Now, with the COVID-19 vaccine, what they're doing is they're taking a piece of the virus. But this piece cannot give you COVID. What it is that the virus itself has different parts to it. At the surface of the virus, the COVID-19 virus, the little spikes, those contain proteins. There's something called the S protein or an S spike. That is what actually binds to the cells of your body, okay? And can start the replication of the virus. The virus needs to continue to replicate itself in order to survive. If it doesn't, it will die out. But in order for it to do that, it needs to attach to a cell in your body. So what they're doing is have manufactured from what they call an mRNA, which is kind of like DNA, or a genome, a how can I say this? Like instructions of the virus and how it works. So they've taken some of those instructions that resembles or replicates the S protein, that piece that binds to your body. They've taken that and they're injecting it into the body. And what they're finding is that when that is injected into the body then responds as if it's, has a virus that it needs to fight. And so it then is able to fight it off if it does get the full virus, because it's already been exposed to a piece of it and it has already made the antibodies to fight it.
Mm.
So there are 3 companies right now that are that are on the top of the COVID-19 vaccine. 2 that I will focus on are the ones that have the most efficacy right now. There's Moderna, and also Pfizer. Pfizer is the company that 2 days ago has filed for for the emergency approval, FDA emergency approval for the vaccine to be given out to the general population.
Yeah, you were telling me that this emergency approval is for use, right?
Right.
I don't know if you're going to get to that, but I thought when you
Yes.
told me that earlier today, like a light bulb went off in my head, and I was like, oh.
Yes. So it's just what it is. It's for emergency use. That does not mean that the trials are completed and found to be 100% safe and effective. For vaccines to become approved by the FDA, they have to go through several phases. Right now, the Pfizer vaccine has completed phase 3. So phase 1 is when they try the vaccine out on a very small group of people. It could be 10. Then phase 2 is when they try it out on even more people, thousands of people or hundreds of people, right?
Mhm.
Phase three is when they really try it out on thousands and thousands of people.
Mm.
So right now, the Pfizer has completed phase three, and that had 44,000 people in its phase three trials. They
Mm.
have found that that's been 95% effective. What does that mean? They found that 95 people got COVID while under the study.
Mhm.
And 90 of those people were in the placebo set, and only 5
Mm.
were in the vaccination set. Okay, let me backtrack a little bit. When you do a trial, you have to have 2 sides or more than 2 sides. You have, especially when you're working with medication, you have the group of people that are getting the medication or the vaccine, and you have a group of people that are getting a placebo, which is nothing at all. These people do not know what they've gotten. They do not know at all, and neither does the company or the research company that has created the vaccine. They're kept blinded until the end of the trial. So what they found because of that, because only 5 people in the COVID vaccine group got COVID, then they're saying that it's 95% effective.
Mm.
Moderna had similar results with 90% efficacy, and they had 33,000 people. Now,
Mm.
these are people that are not just in the United States. These are people that are in other countries, but I believe for the Pfizer report, it was 29 states or 30 states in the US. Um, and they have also uh, made sure, according to them, that they were racially diverse. So they
Mm.
had about 44% of the group to be from different ethnic backgrounds and also ages. Now, in a study, they also are supposed to make sure that they are adjusting for differences in people. So, age, whether or not they have comorbidities. Now, the problem that I haven't been able to find is I don't see the statistics of the people that have participated in the studies, whether or not they do have comorbidities. Now, we do have the number of people that are over the age of 55, and the efficacy was promising, but we don't have that comorbidity aspect. Now, this is where peer reviewing comes in. What does that mean? That other people in the field, other scientists, other doctors, review the study to make sure that there aren't, exaggerations, that things were done correctly. They haven't done that yet. What they have is certain companies or organizations that are reviewing
Mm.
the vaccine as it goes along. Now, back to the original thing in terms of the emergency approval. What that means is that the FDA believes that it's safe enough to start giving it out to the general population, but it is not 100% approval. It takes 2 years to get full FDA approval. So, what they plan on doing is they plan on giving it to the population, closely monitoring them, and following them for 2 more years. Then they can get full fledged FDA approval.
Mm.
You can almost consider this as a continuation of the research, right? So, we would be, in my eyes, a phase four.
Mm.
We've done with phase three. As general population, we will be phase four. So we would be involved in this clinical trials.
Mm.
Um, Let me see. What else can I say? Oh, another piece of the vaccines is that they're giving 2 doses of the vaccine. For Pfizer, it's 21 days apart. For Moderna, it's 28 days apart. Now, for the approval for phase three, which is why Pfizer has already been completed phase three, they have to have followed to make sure for safety for 2 months after the first dose, to
Mm.
make sure that there are no insane side effects or anything that's severe enough that would have to, continue phase three and not safely end it. Um, Let me see. What else can I say about? Do you have any questions? I mean, I have a lot of information here, so
No, what I wanted to do was I wanted to we have another guest on is Judy Gonzalez from the
great.
I don't know if I'm supposed, I guess I'm supposed, but from New York State Nurse Association, she's affiliated. I don't know if she's probably not speaking on their behalf tonight, but she does have a lot of expertise, a lot of experience in the field of healthcare, including doing missions to other countries. And so I think she's and someone who we love very dearly and respect very dearly. So I'm just going to bring her on and let her know. I hope she heard some of your presentation, but we're currently talking about vaccines, and Jessica gave us a lot of information, and because I really wanted to get to with Judy. I mean, we're going to touch on this a little bit more, but I really want her to talk about what's happening with staff in these emergency rooms and in this COVID situation, because I think she can really bring that home. But I do want at least finish having the discussion on the vaccine. But so I don't want to distract you too much, Judy, but this is a hot topic. But we also care deeply about folks working in those hospitals and having to deal with COVID in this country that doesn't really care about them. But maybe we could finish. I don't know if Jessica, if you want to wrap up or say something that you think is valuable about the vaccines.
Um, I I mean, based on what there's limited research, I guess, available to the public right now because things aren't peer reviewed, and we're moving at a rapid pace to get these vaccines out. I would just tell people to please understand what the vaccines are and what they're there to do. One of the pieces that I forgot to mention is that the vaccine is not a cure. Okay, they're hoping that it can provide some sort of antibody or immunity, but they do not know for how long. They're saying right now it could be anywhere from 3 months to 6 months to 7 months. So we need to understand that this is not a cure. And just because you get the vaccine doesn't mean you have to throw out all the other safety protocols out the window. You still need to wear a mask because we have not and won't reached herd immunity, and you still need to socially distance. You need to be careful. And I think that's it. So Judy, you can go ahead.
Hold on, let me Vicente put up a comment. He says, I will not take the vaccine until the 2-year trial period is over. I mean, I think there's a lot of people who have that sense that they don't want to be the first one online. I mean, and either of you can respond to Vicente's statement.
Before Judy goes on, and I'm done. This is my last piece. I think that is something that everyone needs to decide on their own. I'm not by any means a vaccine expert. I do believe in vaccines. I'm not an anti-vaxxer, but I just think that every person should do the research and decide. The trials are promising, and if they can help less people die, then I'm all for it. But that's where I'm coming from.
Okay, Judy.
Yeah, I mean, hi everyone. Sorry, I had another call before this. I don't know what you want. You want me to talk about vaccine? You want me to talk about what's on the ground? What would you?
Well, if you want to say something about vaccine, you can. But
Sure.
really,
quickly on vaccines. I mean, obviously we don't trust our pharmaceutical companies. When you think of the billions of dollars, the way these vaccines got developed, what happened historically, if you think of Jonas Salk and the polio vaccine, the National Institutes of Health or the Centers for Disease Control or these government agencies would be given dollars to be able to do this research, which is not based on profit, but based on actually curing diseases and some kind of moral commitment to do so. Particularly polio is a perfect example because it was a devastating virus that was, caused horrible things to happen to people. And Jonas Salk, if you ever look him up, he's wonderful. He said, I would never want a patent, even though he was the inventor of the Salk vaccine, because this belongs to the people. And that was the mentality, believe it or not, in many ways, in terms of how the population viewed things. Now we have the government giving those billions of dollars to Pfizer, to Moderna, to all these different companies, instead of putting all that money together so that, better work, I think, could be done. So people being mistrustful, obviously there's a reason for that. I am absolutely not an anti-vaxxer. I totally believe in vaccines. I know what happens to people who get sick with these diseases. I've been to countries that worship vaccines because they don't have them. And it makes a big difference. If you've ever seen anyone with polio or with measles or with some of these horrible diseases for which there are vaccines, you'll understand. And I've also been to progressive countries like Cuba that totally believe in vaccines. So I think you have to evaluate your concerns. I mean, I have volunteered for trials and nothing so far has happened to me. But that's how, part of research is volunteering. I think as long as you have to do your own research. But if people didn't volunteer for trials, we would never have anything. So I understand people's concerns, but I also believe in vaccines. Anyway, that's what I have to say about vaccines. I think the vaccine will be important. It'll probably be a while before it's perfected, if in fact it can be perfected. I think there'll be other strains that come out. Coronaviruses have multiple mutations. Some of us who have been ill believe that we had T-cell immunity or previous corona immunity from what we came in touch with. So just to talk about what's on the ground right now, we're seeing a resurgence, obviously, all over the country. What we went through in New York, we're getting PTSD hearing these nurses from Minnesota and South Dakota talking about what it's like. That's what we faced, where you started off the week with one patient, and in the end of the week you had 500 patients, and you just didn't have the capacity to care for them. Our hospitals right now are not prepared at all when it comes to staffing or training. They do have some stores of PPE, but I think many of them are hoarding those stores and giving us inferior products. So there's a lot of movement to get better protection. Like now that I know that people wear masks, I always try to bring to your attention what it's like. If you wear your mask a few hours straight without removing it, moisture builds up. I know you're uncomfortable, right? Imagine wearing a very tight-fitting mask for 12 straight hours under another mask and under a shield and under a head covering, under a gown, with stuff on your feet, with gloves in your hands. I mean, in an environment that does not have the best ventilation. That's what life is like for us caring for these patients. It's extremely uncomfortable. And so our union is, and I am the president of NISNA, and if I have to say something that doesn't represent my organization, I'll clarify. So far, everything is consistent with the organization. We as an organization are pushing the use of these reusable respirators called elastomerics. I mean, we prefer something called a PAPR, which kind of goes over your head like a hood. It has a filtration device. It doesn't hurt you at all, and is very protective, but it's expensive. The elastomeric looks a little bit like a gas mask. It is owned by you. It's reusable for the person, so it's clean. You clean it yourself. You take care of it yourself. You can remove it easily, so you're not wearing that thing all day. And it's cheaper in the long run. So it's crazy that there's no effort to make those things happen. And I think it has to do with something that we went through with the safe needles struggle we had during AIDS. You have companies that don't want to cannibalize their own markets.
Yes.
But still make money off of needles that kill people. And we took 10 years to get needleless devices. So, we're dealing with this capitalist system that, is just antithetical to human survival and thriving. So that's one of the things we're looking at. We have now 2 nurses strikes that are scheduled for December 1st. I'm not sure if you're aware. No. One in New Rochelle, one in Albany. And it's basically active desperation, lack of preparation, and basic union issues around health benefits. If you think of New York City, I don't know how many people, I'm not looking at whoever's on this call, but if you think of New York City versus upstate, in Albany, the nurses in Albany who are professionals and voted in a union 2.5 years ago and have a really vicious employer, their salaries are so low and their health benefits are so costly that the nurses cannot afford the insurance. So their kids are on Medicaid and CHIP. So you have professional people in a union with kids on Medicaid and what that does is the hospital could pay for the insurance for the children, but instead the government, your taxes are paying for the insurance for children of professionals working in an institution that could pay for it themselves. When you think about it that way, we get, that's pretty bad. They're also making them reuse these disposable masks. They say they're sterilizing them, and they're very foul smelling when they're sterilized, and the elastic doesn't last. And even in my hospital, which has resources, they're giving us inferior masks that don't fit well and also are very scarring and uncomfortable and bad. I mean, I'm talking a lot about masks because masks are really important in protecting us. So the thing about training and staffing is a big issue, especially in our hospitals that serve communities of color and our poor communities. The people who work in them suffer. There's a trajectory there. If the community is suffering, the staff is suffering. Staffing is worse. The training is worse. The equipment is worse. The physical plant is worse. The ventilation is worse. You compare a unit in Mount Sinai to a unit in the Bronx and Montefiore, you feel like night and day. So we're trying to expose that by Montefiore where I work, has a facility in White Plains. That hospital is like, a beautiful environment. It's like those dystopian movies where they live in the sky in this beautiful place, and the people on the ground, the plebeians or whatever, live in this sort of filth. I mean, that's the comparison on many levels because of what the clientele looks like and the kind of insurance they have. We have a large Medicaid, Medicare population, or uninsured or underinsured. And the city hospitals are even worse condition because they take everybody.
Right.
And that's the situation there. And we represent nurses in all those areas. So it's a pecking order based on the wealth of the institution and the clientele.
Yeah.
So those two strikes that are looming are based on the fact that the hospitals are just being impossible in addressing the concerns that we have. The staffing issue is serious because what happened during COVID, and even what happens now, but particularly during COVID, there are standards that just are very clear that in an ICU you can only take care of 1 or 2 patients because you're constantly there to prevent the person from dying. And when you're given 5 and 6 patients, it's like the movie Sophie's Choice. I mean, who do I let die today? And who do I take care of? Whose life do I save and whose life do I not save? And that was the kind of trauma that the nurses went through. And physicians. I mean, all caregivers went through the same trauma of having to make these horrible decisions about who they would rescue. It wasn't just about whose back I rub or, whose hand do I hold. It was really about whose life do I save. And I'm sorry, I'm talking, ask me questions.
Okay. No, I know you and I talked because in 2018, when I was in the ambulance, my heart stopped twice, right? And one of the things that came out when the first time COVID was rampant in New York was that there was this idea that if your heart stopped once, they would bring you back or resuscitate or, do what they have to do. But that if you went into that type of situation again, that they wouldn't bring you. They would stop. And I think that was one of the things we saw, right, Jessica? There was a report on that. Do you remember that?
Yes, that was when the surge was really bad in New York City. They were not, I had reports from colleagues in the emergency room that they had to decide, do we continue resuscitation efforts? Not where they're supposed to continue them very early on in that process. And just a lot of people had to die. Because of that. There's just too many.
It was called
patients
going
in
through the
hospital.
motions. I mean, we had in the early period when we realized that health workers were dying, and we didn't have PPE. If anyone was over 70, they didn't even go in there. The nurses were in there, and the doctors would say, "Oh, we're not going in. We can't waste the PPE on this because it's very, very volatile. When a person is arresting, the respiratory secretions and everything are just all over the place. We didn't have ventilation. We didn't have PPE, and and they were saying, how old is the patient? Call the code. They say, how old is the patient? Oh, all right. Well, I mean, it was awful.
Yeah.
When we got more PPE, it was a little bit better. But like Jessica said, so many patients were coding at the same time. And the success rate of resuscitation was so low. I mean, they weren't being cruel. They were just, I'm going to risk my life, and this person's 90% not going to make it, 95% not going to make it anyway. And it was just awful. It's not what we're supposed to be doing. Right. So it really tore the heart out of health workers that they were doing that. And that was something, and that is something that people haven't even processed yet because we're still in COVID. Yeah. And the hospitals were totally irresponsible about preparing properly. Like I kept saying years ago in my hospital, we used to have mock disaster drills. The whole hospital would be energized, pretend there was a train wreck, and we'd have people coming in who were dead, and we'd have to do this, and they weren't. I said, why don't we do that? Like, this is going to be a surgeons. Let's talk about what we do in our hospital, and let's have a mock code again. But there's such an obsession with not paying people for what they call NPT, non-productive time, and that's not considered productive. Training is not productive. We don't have hands-on training anymore. It's all modules and online, and how do you learn to intubate a person by watching a module? It's just the whole nature of healthcare right now is so built on a bottom line, and so much of what we do as healthcare workers is billing, It used to not be that way. We would write our notes. Now, instead of, they say, oh, we have the EMR, isn't that great? Really what it is checking boxes so people can be billed. And we spend so much of our time with this mandatory. We can't even go to the next step to order labs if we haven't checked boxes that make sure the person gets billed for it. You can't even care for patients without fulfilling your obligation to bill the patient in your computer.
I mean, for the next question, you've already answered a lot of it, but I think based on your experience here in other countries, Jose put in the chat, how is it possible that a poor country like Cuba can have so few cases of the virus? What are they doing so different from us? And I would add that in terms of their healthcare staff.
Mm-hmm.
I mean, right, we're supposed to have the advantage in terms of resources and technology. I mean, what's going on?
Yeah, I mean, you live in a society where there's an understanding of a collective as opposed to the individual. So that when there's a directive, I mean, there may be a lot more pressure on people to cooperate as well, but where there's a directive that in order to survive, we're all in this together. I saw a really beautiful story with a picture in it of a country. I think it was in, I don't know, it was in Kenya. And, it was somewhere in a bush country. And the elder said, look at that fruit tree, children. There are all these little children. Look at that fruit tree. There's all this beautiful fruit there. Why don't you race? Whoever gets there first gets all the fruit. And the kids all held hands and ran together because they said, we're one, we're all together. We're all in this together. That was the collective mentality, right? We don't survive if we don't all survive together. And that's not what happens here. That's what that mentality of individualism is why we see what we see in this country today. People just looking out for themselves. And I think that's a really big difference. Also, having faith in the government to protect you, and believing in the science. I think those three elements, obviously a socialist economy, it's very different. But all those elements, but I do think there's something really important about mentality and how people care for one another and help one another. And that kind of collective way of functioning, is what's critical here. People doing their own thing in a synagogue in Brooklyn or in Staten Island where they don't wear masks, that's what happens. People, we have a very serious problem in this country. Whatever we want to say about it, we have half the country that voted for this agenda that is a murderous agenda. And that's, and I don't think they all did it because they're murderers. Right. I think people are buying into this narrative. Yeah. So we have to address that. In my own union, we have Trump supporters. More than I care to admit.
I mean, before we end tonight, I have a short video from the health ministry of Vietnam, because I'm a teacher. And so they made a video to show children and to get buy-in from young people to help preserve the society, to help preserve their families, to help preserve themselves. And I'm going to play that at the end after, we have our discussion. But I have to put something up because Vicente has been posting in the chat about hazmat suits. And I think it's something like what you talked about, right? The personal PPE. And I just have to have somebody here has to talk about hazmat suits in the medical setting, because otherwise Vicente is never going to let me live it down. So can y'all say something about that?
I don't know what you're referring to as a hazmat suit. We had these Tyvek. What happened to us is we were wearing these flimsy things that didn't do anything. That's called non-permeable versus impermeable versus permeable gowns. A hazmat suit is kind of a funny, people say hazmat suit, but I think probably they're talking about the Tyvek suits that kind of are white hooded things that kind of go around your face and cover everything. The point is to have no air. We that was developed as after Ebola, actually. We had a very similar problem with Ebola, but with Ebola, we had a much better governmental response. Obviously, it didn't really take root here. But in areas in which you really don't want to have any kind of contact, where you have contact, COVID is not as big on contact as people tried to make it out to be. And very early on, I listened to a government official talk about, somebody who was apolitical, talk about, the untalkable. Yes, it's really airborne. And he said, and people said, well, why are they not saying it's airborne? He says, it's a lot easier to tell people to wash your hands and get hand gel than to give them PPE, is what he said. He said, I'm not political, but So, and I think, of course, that's coming out now. People are admitting it's airborne, that the contact issue is not as big. Of course, people should wash their hands, because the contact issue is, having immediate action and, touching an area. But it's having someone breathe in a non-ventilated area is a much bigger thing. So the Tyvek suits were good to prevent like that contact. But the big thing is, the respiratory route. All viruses, some have oral, body fluids. There's the port of entry where it most easily enters is what you really have to look at when you're dealing with preventing illness. Masks are really important. I can't emphasize it enough. I bring masks when I'm on the subway. I give them out to people who aren't wearing them.
Good.
I say, "Oh, here, please protect yourself." Everyone takes it when I say that.
That's nice. So,
I did have a comment before we move on, a comment and a question for Judy, actually.
Yeah.
So one of the things in terms of Jose's previous question with Cuba, now Cuba started using remdesivir very early on in this pandemic. And just 2 days ago, the US FDA approved remdesivir for the treatment of COVID. And what they're using it for is kind of like a Tamiflu. So these are for mild to moderate patients who are being sent home if you're showing symptoms within 2 days of seeing a medical provider. And what they're saying that instead of 6% bounce back of people that were sent home and coming back to the emergency room with more severe symptoms, they're seeing a 3% bounce back. So 50% efficacy. But I just think it's amazing that it took us this long to realize how much remdesivir can actually help. And Cuba started doing it early on. And so has, China. Now, I don't know if Judy, you know anything about that and how remdesivir is actually being used in the hospitals. But my other question for you was, are the nurses and doctors using surgical masks, or are they using K95s or N95 masks?
Oh, if there's any suspected COVID, I mean, I walk into the hospital and I put on my N95 right away. I mean, we're wearing N95s when we're anywhere near patients. If the hospital's not necessarily enforcing that in the clinics, and they should, I think you have to, that is your protection, and with a mask over it. So we were at N95 and a mask over the N95, because you don't want to contaminate your N95 with anything any secretions. Your own secretions are going to be on the inside, but on the outside, you don't want them. And I thought Cuba was using interferon B, actually.
They were using both.
Yeah. I mean, I think we know a lot more about the steroids, the blood thinners, and the antivirals. I think that's what we understand to be the basic treatments right now, to prevent replication of the virus. Because the thing with COVID that kills you is not necessarily the virus; it's the autoimmune response to the virus, and that's when we found the steroids were really working and they were really important. And of course, it's not so much, even although it's a respiratory entry, it's really a vascular. It has a vascular component that's much more dangerous, which is why you're seeing people who've had COVID now getting blood clots. We're seeing you remember COVID toes and all that kind of stuff. I mean, it affects your vasculature in the lung. And that's why the clotting mechanism is really screwed up. And that's what gives you the strokes and the heart attacks and all the other things. I mean, Mark knows that really well. So I think that's an important, so we definitely have a much better, I'm not part of the government, but we as medical professionals, have a much better handle on how to treat COVID in a variety of ways. But I do recommend, certain antioxidant vitamins. Vitamin D is really important. Vitamin C, vitamin D, acidophilus, a whole elderberry, a lot of these things that keep your immune system intact, not hyperactive, not hypoactive, but just right. Because, a hyperactive immune system can then bring these sequelae, these things that happen to you in response to the virus with your autoimmune response, which is what was killing people. So keeping yourself healthy and the diet that Mark supports.
Plant-based, yes, plant-based
food. Those things are really important. Exercise, relaxation, yoga, love, happiness, caring for others. All those things that keep your immune system intact are really also very important.
Wonderful, wonderful. So we're going to end the program with a little public health service announcement from Vietnam, and they've translated it into English. I was watching it originally in Vietnamese with English subtitles, and then they went ahead and translated it into English. But before we go to the video, because I'm just gonna let the video rock at the end. Are there any announcements that y'all would like to make before we go to the video, and then just let the show slowly end on its own? Any announcements?
Wear a mask.
Okay.
Wear a mask, please. I do have one more point to throw out there, is that there have been studies that show that asymptomatic people actually shed the virus longer than symptomatic people. So just because you have no symptoms does not mean that you are COVID free, and you may be giving it to more people for longer periods of time. So please keep that in mind. And again, please wear a mask.
All right. Judy, any last words before we go to the video and end the show?
Eating and talking are dangerous if you're in a big group because you're not wearing a mask. If people would just eat and shut up, it'd probably be safer because you're not breathing while you're eating. But people talk and they hang out and they shout and they yell, and that's really where a lot of infection takes place. So, I know people like to get together this time of year, so just please be very careful.
And Jose will not let this go. He wants to know, Judy, specifically, how do we support nurses?
If you live in Albany on December 1st, go to the picket line, support the nurses. If you know Teamsters, tell them don't deliver stuff. If you live in New Rochelle, or you can go to New Rochelle, December 1st and 2nd, please support our nurses on the picket line. We're going to try to do some health health kind of have a health fair while we're out there to provide blood pressure checks and other things for people. Also, just to let you know, when nurses go on strike, we have a resuscitation team. We don't want anyone to die because we're on strike and the hospital's irresponsible. So we have trained teams of people that go in to make sure that nobody dies. We do that as well as be on strike. But you can support us that way and get more people to get interested in nursing and become nurses. We need more nurses.
All right. So thank you, Jessica. Thank you, Judy, for being here tonight. And we hope that we can have you back because, I don't think this thing is over anytime soon.
No.
It just keeps accelerating. And there's so many questions that people have, even, more than we were able to deal with tonight. So thank you both. And we're going to go to the video. All right. Thank you. So this is just a short video from the Ministry of Health in Vietnam to try to get some buy-in, because I know that we are concerned that people wear masks, but there needs to be a process of buy-in. And in this country, there's been so much conflicting information that a lot of people just don't know what to do or feel like they can't trust the official voices. But this is something that was done in Vietnam. It's supposed to be a poor country compared to I'm not sure if there was an echo or what the sound quality was, but this is stuff that other countries are producing, and they're not like coercive, right? It's not like, oh, wear your mask or we'll lock you up. It's more like, hey, we're in this together. And so we have to find creative ways to get the right information out. And we have to find creative ways to support, love, and care for each other. And so a lot of times, when folks are reticent about wearing masks, I don't try to beat them up, But I think, I kind of do like what Judy was talking about. You give them a mask and say, hey, I really care about you and I care about me. And I think we can win people over. We don't have to throw our hands up in frustration and give up. We have to love each other. We have to take care of each other, and we have to get through this together. So, thank you for being here tonight, to the audience and to the guest. And we're going to end as we always do by saying, all power to the people, all love to the people, all caring for the people.